So to step back again and review, there's a chance of a clot forming in your upper chambers because of stagnation of the blood.
Right.
When that clot forms, it could move downstream. If it goes upward, could cause a stroke. We want to prevent that in you. And the way we're going to do that is with a new medication. We're going to use a medication that slows your blood's ability to form a clots. Patients frequently call these blood thinners.
Right.
And for you, we're going to use a medication called warfarin. Now, here's what's important about warfarin. Your key in how well this works. Your role is to make sure that you take your warfarin on a regular basis.
Right.
And if you miss a dose, we want to take that as soon as we remember, unless we're into the next day. And we'll just continue on with that next day's dose. We'd like you to take it the same time each day. When do you take your other medications now?
Right after breakfast.
And how good are you at with that?
Well, I'm pretty good because I have it all in the same spot.
So you've got a plan and you adhere to it.
Pretty much, yeah.
Well, that's what we want to do with your warfarin also. Okay, now, one more thing. Medicine, like everything else in life, nothing's free. So there's some great benefits to the warfarin, and there are some risks. And our job in medicine is to balance risks for you versus benefits. Always trying to put the risk-benefit ratio in your behalf. And the risk-benefit ratio of taking warfarin is way in your favor. The risk side of it is you may have a tendency to bleed more easily. That would come into play if you cut yourself, if you're in an automobile accident. So we may want to have a card in your wallet and even a bracelet that notifies people that you're taking warfarin. You want to be certain to alert your other healthcare providers that you're on warfarin, and that includes your dentist. Before you have any procedures, we may want to make some adjustments depending upon what it is that you're having done. Okay?
Okay.
So what we've covered then, you need to be consistent with your medication, fairly consistent with your diet, aware of the risk side of it, which is possibility of bleeding excessively if you're injured, and having some bleeding if you're having a procedure done by one of your other healthcare professionals.
So I'm taking the warfarin, but does that completely cut me out for risk of stroke, or could I still have one?
Your risk of stroke is significantly minimized to the point where I want you to live your life without fear of having a stroke.
Okay.
I'm not going to tell you it's zero because it isn't. Let me tell you this. Of the people taking warfarin, at any given time, only 50% of them have their dose in the range where it's thinning their blood appropriately, slowing down the ability to form a clot appropriately. You're going to do better than that, however, because you're going to be consistent with your medication and consistent with your diet. And if we do those things, we're going to be okay. So before you go home today, I'm going to review with you again and provide you some materials about diet and shopping, and talk to you again in a couple days. And I'm going to see you back in a few weeks, and she'll set all that up for you.
Okay.
Okay?
Okay.
We're going to do fine together, Mrs. Orr.
Thank you very much, and I appreciate all the help.